Today, we're talking about a terrifying medical emergency, one that can start with the worst headache of your life, and the absolutely incredible AI that's being built to stop it dead in its tracks.
I mean, just think about that for a second. Out of absolutely nowhere, a sudden, blinding pain. It's a pretty alarming thought, right? Well, for thousands of people, it's a terrifying reality.
Because for so many, that headache isn't just a migraine. It's your brain's final, screaming alarm bell before a potential catastrophe.
So, if we're going to understand how AI can possibly solve this, we first have to get a handle on the problem itself. And it all starts with a very specific and, frankly, terrifying kind of pain.
Doctors actually have a name for it that sounds just as dramatic as it feels: a thunderclap headache. And believe me, it lives up to the name. It hits maximum intensity in under a minute. This isn't some slow buildup. We're talking about an absolute explosion of pain.
What's even more alarming is that this thunderclap headache often acts as something called a sentinel headache. Think of it like a warning shot from your own body. It's a massive red flag that a small bleed might have already happened, signaling that a much bigger, life-threatening brain hemorrhage could be just around the corner.
And this, right here, is such a crucial point. Get this, up to 60% of people who suffer a major brain bleed actually had one of these warning headaches in the days or even weeks leading up to it. That's a huge window of opportunity to step in, but it's a warning that is tragically so often missed.
So you can imagine when a patient shows up in the ER telling this story, it kicks off a super high-stakes investigation. It becomes a frantic, desperate race against the clock.
Now, the clinical guidelines on this are crystal clear. First things first, you get an immediate CT scan of the head to look for any signs of blood. But, and this is a big but, tiny little bleeds can be really hard to spot. So if that CT scan comes back negative, the protocol demands a lumbar puncture. Yep, a spinal tap to check the fluid around the brain for any hidden evidence of blood.
And this really gets to the heart of the challenge. On one side, you've got the radiologist, who's manually scrolling through hundreds of individual CT scan slices. They're under immense pressure, they might be tired, and that heavy workload means a tiny, subtle microbleed could get missed. But on the other side, you've got the emergency itself. The clock is ticking. A bleed can expand in a matter of hours, and every single second of delay can have a massive impact on whether the patient has a good outcome.
But what if there was a way to give that human eye a kind of superpower? A way to scan for these dangers with superhuman speed and accuracy? Well, this is where our digital detective enters the story.
Yep, you guessed it. The solution is artificial intelligence. Specifically, a system that's designed to see the exact things that even a highly trained human eye working under incredible pressure might miss.
Now, we're not talking about just any old AI here. This is a 3D convolutional neural network, or CNN. It's a very specific kind of AI that's just perfect for this job, because it doesn't just look at flat 2D pictures one by one. It analyzes the entire 3D volume of the brain scan all at once, which lets it understand the shape, size, and patterns of a bleed inside the brain.
So how does this digital detective actually do its job? You know, how does a machine learn to see something as complex as a brain hemorrhage?
Well, it all starts with data, and I mean a lot of data. This AI was trained on thousands upon thousands of CT scans that were already labeled by experts. By seeing all these examples of different kinds of bleeds, whether they're on the surface of the brain or deep inside the tissue, it starts to learn the incredibly subtle visual cues for danger.
The way it's built is actually pretty ingenious. This diagram shows what's called a U-net model. You can almost think of it like an expert art restorer. It first breaks the image down to its most basic shapes and patterns. Then it carefully rebuilds it. And by comparing its perfect reconstruction to the original, it can instantly spot anything that looks out of place, any little abnormality.
So let's just break this U-shape down a bit. The left side is the part that takes the image and kind of summarizes it, capturing the big picture. The right side is the part that builds it back up. And those lines going across the middle? That's the secret sauce. They're called skip connections, and they make sure that all the tiny, fine details from the original scan make it into the final version, so absolutely nothing important gets lost.
Okay, so the theory sounds amazing, right? But does this thing actually work in the real world? Well, let me tell you, the results are nothing short of incredible.
And here it is. The proof is in the pudding. Just look at this table. The AI model was tested on its ability to spot all these different types of brain bleeds, and the results are just stunning. For pretty much every major type of hemorrhage, the AI's precision and accuracy are consistently in the mid-90s.
Take epidural hematomas, for example. This is a type of bleed that can be fatal really, really fast if it's not caught. The AI hit 96% precision at identifying them. In an emergency room, that level of accuracy isn't just a game changer, it's a lifesaver.
And what about subarachnoid hemorrhages? The very thing that those sentinel headaches are warning us about? The model achieved 95% accuracy. That is a direct, powerful answer to the huge diagnostic challenge we started with.
So this all brings us to the future. And it's important to say, this technology isn't about replacing doctors. Not at all. It's about giving them an incredibly powerful new co-pilot in the cockpit.
And hey, don't just take my word for it. The researchers themselves say it best right in their paper. The goal is enhancing diagnostic speed and accuracy to improve how things work in the hospital and, most importantly, improve patient care.
So, the bottom line is this. AI gives us a way to slash those dangerous delays in getting a diagnosis. It can act as a safety net, flagging the most urgent cases for doctors and helping them make faster, more confident decisions when every single second counts.
When you see this kind of remarkable progress in just one tiny corner of emergency medicine, it really makes you wonder, doesn't it? With AI ready to become a standard tool in every doctor's toolkit, what other impossible challenges are we on the verge of solving next?